I am Tobiloba. I'll be presenting my United Assignment presentation on the roles and responsibility of registered nurse. Introduction. In this presentation, I am going to discuss about the recent changes and their impact on the roles and responsibility of the registered nurse in terms of patient care and the community at large. The role of the Nursing and Midwifery Council as a professional body for nurses. I'll be analyzing the code of nursing practice and the role of registered nurse. Finally, the need for effective communication and the effectiveness of the communication in a multidisciplinary healthcare settings. The role of a registered nurse and their recent changes. The RNC define nursing as the use of clinical judgment and the provision of care to enable people to promote, improve, maintain, or recover their health, or to cope with their health problems, to achieve the best quality of life, whatever their disease or disability, unto death. A nurse must be healthy and of a good character. NMC promotes public safety and ensure high standard for healthcare through education, training, conduct and performance standards. They are also recognized as a group of health professionals, and their requirements are that they are prioritizing people, practicing effectively, preserving safety, and promoting professionalism and trust. The role and responsibility of registered nurse changes suddenly to balance the modernization of the NHS Trust. Within their disciplines, they generate research based knowledge on which their judgment, skills, and practice are based. Regulated by their own members, are required to behave in accordance with guidelines determined by their professional bodies and accountable for their decisions and actions. With these recent changes, brought Project 2000, which introduced and emphasized the need of higher and continued education. In nursing, it moved nursing education into universities and worked closely with the NHS, which makes the profession more scientific and specialized. There are many recent changes that have had an impact on the role and skills profiles of nursing and other health professionals. We have the political, the economic, the social, the technology, organization. We have the professionalism policy. And in political changes and economic have had huge impact on nursing, what I've said before. These changes have resulted in nurses that and the other health professionals becoming more accountable for their actions and decisions. However, new technological advancements have shown great progress in the aspect of better patient care, such as new computerized care planning, which make it easier and more confidential for the nurses and the patient, as well as the new and updated NHS improvement plan, which have increased the capacity with the ever-growing demand and the ways patients are guided into the new system. It gives more responsibility, widening patient care services throughout the community. Nurses can now work independently by substituting for doctors and GPs and hospitals, conducting health assessments and delegating with their health professionals, which gave more accountability and choice. The money that is contributed for the public, the more resources the NHS has, and vice versa. In financial crisis, the NHS sees cuts to ensure the country does not borrow money and go into bankruptcy or debt. In 2011, Due to recession, trade unions influence pay scales and the contract that makes the government impose at 1% cap of NHS pay, which rises and causes negative impact of strikes and staff retention problems. This was scrapped on 2017 during the RCN campaign. And when talking about the technology changes, it's a vast speed which has led to technical advances, not only changes on paper medical records to primary digital, but other instruments have been added to the nursing, such as mobile tracking systems, smart beds, wearable devices, and mobile apps. The technical advances have quickly reshaped the NHS. Nurses' constant training must be kept to date. With this and the information being computerized, makes it more accessible to all other health professionals, not only nurses alone, but other health professionals, making services more effective for users. Nurses must be responsible to the needs of the patient because of the social changes when given medical decisions. Patients and families are now able to research and therefore more than and therefore it is important to be transparent and give them all options with a more transparent complaint and feedback, which is essential for nurses to listen and learn from all the feedbacks. These are the recent changes that occurs uh, with the role of registered nurses. To the next slide, we'll be talking about the Nursing and the Midwifery Council, which provide regulated standard in education, conduct, and performance to protect the public as the nurses and midwives who abide by the regulations. They were established in 2002. Registered nurses must revalidate their registration every 3 years to ensure they are safe and fit to practice. They look at factors such as the CPD with high standard, which high standard must be met to revalidate their place on the register, including the 450 practice hours and 35 hours of CPD. A reflective discussion with NMC registrants, a health and character declaration, appropriate professional indemnity and insurance arrangements, and confirmation that all requirements have been met with the NMC, these are all the requirements the NMC put together to make a standard for a registered nurse. So the NMC regularly publishes guides to ensure all registrants are kept up to date with changes and reminded of their commitment to the NMC code. Now to the NMC code, we have the 4 Ps for the code Nursing and Midwifery Council, which are to prioritize people, practice effectively, preserve safety, and promote professionalism and trust. These are the 4 Ps of the NMC code. The NMC sets the standards for the code on nursing practice. The code looks at patients and public expectants to create a code that includes professional standards that nurses must commit to. It promotes safe practice in the workplace. Excuse me. In the workplace, it can be used by service user to provide feedback, and it can be used in education to show what it really means to be a registered professional and what will be expected of the students. Prioritizing people is one of the NMC code, which I've mentioned earlier. In nursing, putting people first always, and patients' care and safety is always the priority, and their dignity is always upheld. A nurse must ensure that all the patient's needs are recognized, assessed, and then responded to. The nurse must ensure and the patients are treated with respect and that their rights are upheld. If discrimination is witnessed, it must be challenged immediately without any mistake. Secondly, practicing effectively is also important in NMC code. Nursing must assess the need of the patient and then deliver the treatment to the best of their ability or advise on the treatment without delay. Nurses must also communicate effectively with the patient, their family, and colleagues by keeping and maintaining clear and accurate records. Any feedback given must be reflected on and acted upon to always improve. We have the number 3, which is preserving safety is the third standard of the code. It is the nurse's responsibility to ensure that patient or public safety is not affected. They must always work within their own sphere of competency for the safety of the patient and has a responsibility to raise a safety concern immediately. Lastly, which is promoting professionalism and trust, is also one of the vital standard of NMC code. Nurses have a responsibility to uphold the reputation of professions. Nurses must show commitment to the code and be a role model to integrity and leadership. Moving on to the effective communication, which is important in building effective and respectful relationship with patients, colleagues, and patients' relatives. Communication skills are recreated throughout the NMC code as it is uh, in 2015, as it is one of the most important skills for a nurse to possess and practice. Registered nurses are required to communicate clearly, listen, and respond where supporting individual needs and rights of the patient. This encompasses communicating in a way which can be understood, meet the language needs of the patient and their family, and importantly, being culturally sensitive in all times. Communication within the multidisciplinary team is very important in nursing by communicating with them, updating them, and attending meetings. Nurses must ask for another health professionals from their team if the task is outside their competency. According to the nursing process, nurses are responsible for assessment, diagnosis, planning, implementation, and evaluation. Nurses are taught to demonstrate three keys aspects of effective communication, which are professional communication, provision of information, and handover. In addition to this, nurses consider both verbal and non-verbal communication, which include body language, tone of voice, and facial expressions. These are important for both patient care, interaction, and family members, also with other members of staffs. Effectiveness Effectiveness of multidisciplinary team approach in the healthcare settings. Healthcare settings require many different care and medical disciplines to work together. It is imperative for communication skills in particular of all staffs to be at their best, as without this, the team may not work well together and may not meet the need of the patient. The key to a successful teamwork in a multidisciplinary team starts from an agreed approach in which everyone work with their scope of practice. Each member must be committed to support the team and cooperate with mutual respect. There should be a focused goal and an agreed framework to review progress towards the goal. Finally, the team should have a coordinator responsible for overseeing the treatment plan for the patient. Nurses must abide by specific rules, policies, and procedure by using a multiplicity of tools and skills gained through meetings and independent learning sessions. Having to overcome communication barrier in an important and crucial step to managing patients' needs. Body language as well as verbal communication has a big part to play in patients' ability to trust professionals looking after them. Creating a trustworthy, safe environment can put patients at ease but deflate any frustration, mistrust, and faith in the system that are in place to ensure their well-being is top-notch. The nurse's role The nurse's role in a multidisciplinary team is more than just caring for the patient. Registered nurses use different tools to work in partnership with the patient, making the patient central or to the care they receive. Nurses follow a path of interrelated stages to coordinate multidisciplinary team working, including assessment or data collection, nurses diagnosis using clinical judgment, planning with nursing interventions, implementation and validating the care plan, and continual evaluation. The success of the nursing process depends on the quality of the relationship built between the nurse and the patient, but it is thought to achieve effective interventions and positive patient outcomes. Overall, patient outcomes overall. Anderson's theory categorized nursing activities into some components based on human needs. These activities stem from Maslow's hierarchy of needs and allow nurses to assess the patient with a holistic approach that covers their psychological or physiological, spiritual, and social health needs. In conclusion, from history and recent nursing, from history and recently, nursing has changed and it is a profession that will constantly change due to new demands. The NMC was established to protect the public and ensure that nurses are competent, fit, and able to work in the profession. Revalidating is every 3 years, which allows to ensure that registered nurses are adapting to the constant change. Nurses also strive to work in partnership with their team across discipline with patients and families. In my recommendation, implementing conversation with registered nurses and other professionals may give greater insights to how effective communication and teamwork is put into practice with the workplace, as well as how it has improved their journey through patient care, working closer with improved individual knowledge and provide better guidance and understanding above the rules and responsibility of the registered nurse. Thank you.